So I wanted to spend just a couple of minutes today talking to you about health care reform and the President's plan, because I think it's particularly dangerous for somebody like you. You're on Medicare, and you know he's planning to cut $500 billion out of Medicare, and they've got this 21% reduction in Medicare reimbursement, and I'm worried that I'm not going to be able to see you anymore. And we've been together for a long time, and that would hurt both of us. So do you and your friends, do you know about these Medicare cuts? And
as much as I know about it, they're going to take money from Medicare to pay for something else.
Yeah, it's going to be to pay for all these other people that they want to try and get insured.
Other than that, I really don't know much about the plan.
Hello, my name is Fred Shessel. I'm a full-time privately practicing urologist in Atlanta, Georgia. I see almost 5,000 patients a year, and for the past year I've been asking most of them if we could spend a few minutes at the end of their visit to talk about health care reform. I've been in practice for almost 30 years now, so many of these patients are actually my friends as well. That's why I take it very personally when I have to turn to these people and say, you know, under Obamacare, I may not be able to take care of you to the best of my ability, or I may not be able to see you at all. In my conversations with my patients, most of them are concerned about cost, quality, and access. We know that Medicare is going to be cut by some $500 billion, but most people are more worried that if they lose their job and they lose their insurance, they won't be able to see me anymore. As a matter of fact, most of them wish the President would spend more time fixing the economy and less time trying to ruin health care. But under Obamacare, one of the big problems is that the Secretary of Health and Human Services will be given sweeping powers to determine what kind of treatment should be undertaken for any given medical condition. Now, the last time I looked, Kathleen Sebelius went to law school, not to medical school. So how can someone who does not have a medical degree and has never even met you determine what's going to be the best form of treatment for your kidney stone or for your prostate cancer? Right now, if you were unfortunate enough to have prostate cancer, I could offer you 5 different treatments, including the most modern, which is robotic prostatectomy. But under the government's rules, you'll be given a one-size-fits-all treatment plan that's based on cost, not what's best for you. When I graduated medical school, I swore the Hippocratic Oath promising to do no harm. But the problem with this legislation is it's going to harm my patients. This is a compendium of all the medications that we have available to us. This is a facsimile of the Senate health care bill. As you can see, I'm going to spend twice as much time trying to figure out government regulations as I am determining what's the best form of treatment for you. You know, President Obama has said that the majority of doctors in this country, including the AMA, support his health care plan. He said this in front of starch white coats in the Oval Office and in the Rose Garden. But let me tell you what real doctors tell real patients when there's no teleprompter around. We are not in favor of this health care plan. The AMA only represents 17% of the doctors in this country, and many of them do not agree with this plan. In fact, the AMA is more interested in continuing its government-sponsored revenue stream than it is in representing the interests of the doctors and patients of this country. Let me tell you what real doctors say in real offices, not the Oval Office. What we say is when you get sick in the middle of the night, who are you going to call? The White House? 1-800-BIG-GOVERNMENT? No, you're going to call the doctor that you know and who's taking care of you to the best of his ability. Finally, I tell my patients that we'll be suffering a severe doctor shortage in the near future. Many of the best and brightest will not go to medical school. Why would you suffer through 10 years of postgraduate training and incur hundreds of thousands of dollars of debt to be a government employee? As for those of us that are in practice, many will quit if and when we pass Obamacare, because we realize that we will not be able to take care of patients to the best of our ability. As a result, much of your care in the future will be delegated to paraprofessionals, nurse practitioners, and physician assistants. While these people are extremely well trained and highly competent, they are not doctors. Barack Obama has said that his form of health care reform is necessary to save American medicine. But the problem is his system comes from economists, academics, and policy wonks. If he wants to know about real solutions, he needs to talk to real doctors and real patients. Almost all of my patients tell me they're happy with what they have, they just want it to cost a little less. And we know there are common sense, market-driven solutions to reduce costs without throwing out all the things that are wonderful about American health care. The one thing that all of my patients tell me, without a doubt, is that they reject the notion of a government takeover of health care. I know that my patients understand the power of the ballot. They are disgusted with an administration and a Congress that won't listen to them. But come November, I am confident that their voices will be heard.